So, talking about suicidal wounds and homicidal wounds, left side of the neck and passing across the front of throat, rarely on both sides, rare on the both sides in suicidal wounds. But in homicidal wounds, it will be present on both sides. Talking about the level, it will be high above the thyroid, but in homicidal wounds, it will be low below the thyroid. Direction, it will be above downward and from left to right in right-handed person. Sometimes horizontal cuts across the front of the neck are seen which do not show variation in depth of either end. But in homicidal wounds, you will find transfers are from below upwards if attacked from right side of the victim. The wound runs from left to right. If from behind, it may resemble suicidal wound. Talking about the number of wounds may be multiple, 20, 30, superficial, parallel are merged with the main wound, rarely single. Multiple cross each other at a deep level, not repeated in depths of the main wound. Edges usually ragged due to overlapping of multiple superficial incisions. Here sharp and clean cut beveling may be seen. Here hesitation cuts are present, here hesitation cuts are absent. Because in homicide there will be homicide. Why hesitation will be the tailing present in suicide, no tailing seen in homicide. Talking about the severity, usually less severe. One wound may be extremely deep, extending up to cervical vertebra, but sometimes 2 or 3 can also be seen. Most severe, it will be very severe, homicidal, more severe. All the tissues, including the vertebra, may be cut. Talking about the severity, talking about wounds in other parts of the body, often present across wrist, groin, thighs, ankles, or knees, and rarely on the back of neck. But in homicide, more severe, all the tissues, including the vertebra, may be cut. Here, the vertebra may be cut. Talking about the defense wounds, absent, unintentional cuts may be found on the fingers if a blade has been used. Here, the defense wounds will be present. Defense wound will be present. Talking about hands. Weapon may be firmly grasped due to cadaveric spasm. Here, fragments of clothing, hair, etc. may be grasped. Weapon will be present, here weapon will be absent. Talking about vessels, as head is thrown back, carotid artery is drawn beneath sternomastoid and against the spine and usually escapes injury. But here jugular vein, carotid artery, all are likely to be cut. Blood stains, if standing, stains on the mirror and on the front of the body and clothes running from above downwards and splashes on feet. If asleep, blood runs down on both sides of the neck and collects behind the neck and shoulder. Stains found on both palms for the victim attempts